my name is Kelsey, and today I'm going to be conducting a head-to-toe assessment on my patient, Becca. First, going to start by washing my hands, and then doing an overall inspection of the patient, head to toe, looking at skin, any discoloration, thickness, irregularities, or abnormalities of the arms, the fingers, bilateral legs, and the toes, which none are noted. From there, we'll look at hair, distribution, texture, the scalp, any areas of balding, which there are none. Next, I'd look at the head and neck, looking for symmetry, again, abnormalities, masses, discolorations, which both are symmetric. Starting from up here, I will palpate the temporal arteries, which are 2+ bilaterally, and then using the bell and my stethoscope, I will auscultate the temporals. Good. Good. And a bruit is noted and present. Next, I will assess the sinuses, palpating. Any tenderness or soreness there?
Nope.
Good. No abnormalities either. Both are symmetric. Then assessing the TMJ, I will palpate. And can you open your mouth for me? And close? Open and close. Good. No clicking. Any pain with that?
Nope.
Awesome. From there, I will assess, don't do that yet, the lymph nodes, palpating head, clavicle, and axillary. Lift this arm for me. Good. No abnormalities noted, no areas of swelling. Standing behind the patient posteriorly, I will palpate the thyroid. And can you swallow? Great. Both sides symmetric, again, no areas of abnormalities. Next, I will palpate and auscultate the carotid arteries. Doing so one at a time to ensure that blood flow will not be obstructed to the brain. Good. Both are 2+ present. And then using the bell, auscultate. Okay. And a bruit is noted bilaterally. Next, we will go to the eyes, inspecting externally, looking at eyelashes, symmetry. The sclera is white, no notable areas of jaundice, and then palpating the upper lids and the lower lids. Again, no swelling or redness on either. Next, we will test extraocular movement. So looking straight ahead, I'm going to have you follow my finger. Need double vision or blurry vision? Good. And then the other side. Great. No nystagmus or strabismus is noted. Going forward, we will assess peripherals. So I'm going to have you look straight again at me and tell me when you can no longer see my fingers. Good. Looking at the eye with my scope. Oh, we'll start pupillary. I'm going to have you look straight again. Using the light, I'm going to assess pupillary reflex. Good. Pupils are equal and reactive to light. I'm going to turn the light on and look at further assessment at the optic disc. Again, looking straight. Optic disc is sharp, no abnormalities, no redness areas. I do not have a Snellen chart, but if I did, I would have the patient stand 20 feet from the chart, closing one eye at a time, reading the lowest for this on the chart to assess visual acuity. reading across accurately. If they were to wear glasses or contacts, they would keep those on and or in while doing the assessment as well. Moving on, we're going to go to the ears. Changing my scope. We'll first assess the ears, looking for any masses, hard areas, or tender areas. No redness is noted. And using the otoscope, we will pin back the pennant and look into the ear canal at the tympanic membrane. Good. And then the other side. Good. Tympanic membrane is pearly gray. Ear canal is pink. No lesions or abnormalities. Next, I will conduct the Whisper, Rhine, and Weber test. Using the Whisper, I'm going to have you cover your right ear. I'm going to stand behind you and just recite what you hear me say.
99.
Great. And then again.
99.
Perfect. Then use my tuning fork to perform the Weber. So I'm going to place this on your forehead, and you tell me if you can hear out of both ears bilaterally.
Yep.
Is one louder than the other?
Yep.
Great. Next, with the Rhine test, we will hit the tuning fork, assess hearing on the mastoid bone, and then again on the external ear. I want you to put a finger up when you can no longer hear it, and then I will move it, and then we'll do the same on the other ear.
Okay.
And then the other. Okay. From there, moving on, we will assess the nose. I keep getting out. Assess the nose. Get my light. Looking at it externally, there's no abnormalities, with the exception this patient has a piercing. Totally fine. I'm going to have you occlude or block your left side and breathe out your right. Good. And then vice versa. Good. We're going to perform the smelling test, so I'm going to have you close your eyes. Block your right ear. I'm sorry, your right nose. Right there. And then tell me what you can smell out of your left.
Is that garlic salt?
Yep. And then we will do the opposite, so occlude your left and take a deep breath in through your right.
Cinnamon.
Yeah, it is. Perfect. And using the scope, we'll take a look into the nair itself. Good. Nairs are pink. There's no areas of redness, swelling, and septum is midline. Good. Moving on, we will assess the throat. So I'm going to have, get my light. And I'm going to have you open your mouth, tongue out. Good. Tongue up, down, to the left, to the right. Great.
I said that wrong.
That's okay. Mucosa is pink, moist, intact, no areas of, or abnormalities, I should say. I'm not going to perform the gag test today, but if I were, I would use a tongue depressor, which I have here, and lightly palpate the back of the patient's throat and would expect a gag reflex response in doing so. But we'll save that for another day. Moving on to cardiac. I'm going to first inspect for a jugular vein distension. So ideally the patient would be at a 45-degree angle. This is our best attempt at a 45-degree angle. And then using my light, my measurement, I will measure. You're looking at the highest point detected and measuring this so. So I'm going to have you look to your left. Great. And that looks as normal. From there, we'll do pulses. From there, we would assess the PMI of the heart, which is located in the left fifth intercostal space. So we'll listen to that. which is the highest point of amplitude from the heart, the apex.
Your computer.
What's that? Oh, sorry, my computer times out. Thank you. Great, and that is audible. Before I do the other heart sounds, I'm going to assess pulses. So we already did the carotids. Moving down, we will do the brachials. So I'll have you put your arms out. Great, which are bilaterally 2+. And then the radials. Good, which are also bilaterally 2+. I'll have you scooch up just a tad. Moving down, move this so you can see it. Will be the popliteals. Good. The dorsalis pedis. And the posterior tibialis. While I'm down here, I could assess, which are also 2+. While I'm down here, I could also assess perfusion, which your feet are a little chilly, but other than that, all is as expected. Next, I will do heart sounds. So I would first see the aortic valve, which is at the right second intercostal space, the pulmonic left second intercostal space, Erb's point, which is the third left intercostal space, tricuspid, which is at the fourth, and mitral, which is at the fifth. So using the diaphragm, I'm first going to start to assess S1, S2, which would be the lub-dub, as you would identify as a normal sounding heart. All sounds are noted, and then using the bell, we would assess the same areas to assess for any abnormalities or S2 or S3 or murmurs. Good. No abnormalities are noted from there. Ideally, with cardiac, respiratory, and gastrointestinal, it would be ideal to have the patient in a Johnny, but for these purposes, we are doing it over the close. Okay, moving on from there, we will assess the arteries. So I'll move these pillows and just have you lay down. I keep this one. By arteries, we're looking to auscultate the aorta, iliac, femoral, and the renal. So we'll start with the aorta. Good. Moving down to the renal. Iliac. And femoral. Good. While I have the patient in this position, earlier I would also assess the femoral arteries, but it just makes sense to keep it at this point, which are also 2+ and palpable. Okay. You can sit back up. Next, we'll do capillary refill of the fingers and toes. So I'll have you stick your fingers out. I'm going to push down. Fingers are cold. Good. Less than 2 seconds bilaterally, and then moving down to the toes. Good. Also less than 2 seconds on the toes as well. Next, we'll move on to respiratory. First, we will palpate for fremitus. So, posteriorly, I'm going to palpate and have you say 99.
99.
And again.
99.
Good. While I'm back here, I'm going to have you take a deep breath in and out. Good. Lungs are symmetric on both sides bilaterally. Good. Now we're going to listen to the lung sounds on the front. There are 6 anterior and 10 posterior. I'm going to have you take a deep breath in, first using the the diaphragm stethoscope to assess. Deep breath in for me. Good. Good. And then again on the back. Deep breath. Almost done. Last 2. Good. We're going to do that all over again, but this time I'm going to have you recite the name 99, and then the letter number is 99, and then I'll move my stethoscope in all those same locations.
99. 99. 99. 99. 99. 99.
Good. And posteriorly.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
Great. All are equal and bilateral, anterior and posteriorly. Next to those same locations, we're going to percuss. So I'm just going to apply some pressure.
Yep.
Let me know if any of this hurts. Okay?
Yep.
Perfect. Posteriorly. Good. Any issues with that?
Nope.
Everything feels okay?
Yep.
While I'm back here, I'm going to percuss CBI, which we'll get to kidneys in the next portion, but while I'm back here, I'm just going to apply some pressure and you tell me if there's any tenderness. Any tenderness?
Nope.
Perfect. Alright, great. Moving on, I believe we can go to gastrointestinal. So I'm going to have you lay down. I'm going to visualize the abdomen again. This would be a lot easier. Sorry, this would be a lot easier if the patient was in a Johnny, but just from looking here, there's no notable hernias or any masses or areas of concern. In the order of observation, auscultation, percussion, and palpation, I'm going to start in the right lower quadrant, auscultating. In all 4 quadrants, the patient has hypoactive bowel sounds. From there, we will percuss. We're going to percuss zigzag at 3 spots in each quadrant. Let me know if any of this is sore at all.
Yep.
Good. Any soreness with that?
Nope.
Great. And then with light palpation, I will do also in all 4 quadrants. Good. No notable abnormalities. If I were to do deep palpation, it would require one hand anteriorly with an additional posteriorly, applying a great amount of pressure. I would apply those areas looking to feel the spleen, which is under the right rib cage, not usually palpable unless enlarged. I'm sorry, the liver. I said the liver. The liver is on the right side. The spleen on the left side under the left rib cage, and posterior would be the kidneys, which are rarely palpable. If they are inflamed, the right more so than the left. Okay, I believe that's all for that. I'll have you sit up. Next, we are going to move on to musculoskeletal. So, we're going to inspect the joints of the shoulders, the arms, the legs, the hands, wrists, ankles, and toes. So, starting, let me make sure you can see. Starting with the neck, I'm going to have you push your head forward, push your head back. Good. You shrug your shoulders up and down. Excellent. And then bring your ear to one side and your ear to the other side. Just want to make sure you can see me. Okay. And then against resistance, I'm going to have you push your head back and push your head forward. And then against my resistance and against my resistance. Good. And then moving on to shoulders, I'm going to have you lift your shoulders up. Actually, I'll just do it first. And then down. And now against resistance. Good. And now you're going to rotate your shoulders forward and backwards. Any pain or
no
with that? Good. Moving on to arms, I'll have you put your arms out and then your arms together. Great. Crisscross for me. Awesome. And with your arms out, I'm going to have you push against my resistance. And now push. Good. Any soreness with that?
No.
Okay. Elbows will do the same thing. We're going to flex and extend. Good. I'm pretty sure I just did this. There we go. Perfect. Supination, pronation. Good. Move your hands out. And in. Awesome. While you have your hands out, we'll do the wrists and the fingers. So I'll have you flex. I'm sorry. And then extend. Good. And we'll have you go outward and inward. Any issues with that?
No.
Okay. I'll have you push against my hands. Good. And again. Excellent. And squeeze my fingers. Great. We'll move this. I'll have you stand. And I'm going to have you bend forward and touch your toes. And then stretch back. Stretch.
Oh, sorry.
Perfect. That's okay. And now side to side. And hands on your hips. And rotate. Looking at the window and then the wall. And vice versa. Perfect. And you can sit back down.
Yes.
Oh, we'll actually do the hips while you stand. Sorry. I'll have you flex your leg. Yep. Extend. I'm sorry. Yep.
Oh,
and
yeah,
then... That's okay. You got it both. And then I'll have you come out. And then in. Good. And now with your other leg. Out. Back. And in. Great. Now I'll have you sit. Any issues with any of that?
No.
Okay. I'm going to fix your knee like this. Sorry. I'm going to bend your knee and outward. Now can you do it inward? I'm sorry, upward and outward. Yeah. Good. Any problems?
No.
Okay, and same with this one. Good. All right. And don't let me push against you. Good. And don't let me pull against you. Great. From there, we will do the ankles. So I'm going to have you, flex up, flex down. Good. Can you curl your toes? Straighten your toes. Good. And I'm going to have your ankles go inward and now outward. We're going to do dorsiflexion and plantar flexion. So I'll have you push down on my hands and up against my hands. Good. Any issues with any of that?
Nope.
Great. Moving on to neurological. We'll do reflexes. I'm going to have you put your arm out. Good. Perfect. And then this side. Good. All reactive. And plantar, and then Achilles. We did the plantar. Let's do it again. I'm sorry, patella, not plantar. Good. All right. Perfect. We'll do cranial nerve 5. So I'm going to have you clench your teeth, smile, frown. Good. And move your jaw side to side. Excellent. Next, we'll do the dull, sharp sensation. So one of my items is going to be dull. The other is going to be soft. I want you to close your eyes and tell me which one I am touching with.
Okay. Sharp. Sharp. Dull.
Okay.
Dull. Dull. Sharp.
Excellent. You can open your eyes. Have you raised your eyebrows? Good. We did smile tight. Good. We'll do the lower legs too with the dull sharp. So I'll have you close your eyes again. Tell me which one.
Sharp.
Oops, sorry, that was an accident.
Sharp. Dull. Dull. Sharp. Dull.
Perfect. All right. And say ah for me. Tongue out. Great. Okay, for motor skills, I'm going to have you stand up. All right, I'm going to have you walk to the window. Just normal as you would. And then walking back, I want you to go toe to heel, like a sobriety test. Good. And now walking towards the window again, I'll have you walk on your tippy toes. And walking back, you'll walk on your heels. Good. I'll have you sit again. And close your eyes and put your finger to your nose for me. First with your right hand and then with your left. Good. Can you rub your ankle against your shin? Yep, and then on the other side. Any issues with any of this? Any dizziness? No. Okay. Next, I'll have you supinate and pronate your hands rapidly on your legs, back and forth. Great. Perfect. Next, going back to sensory, I'm going to have you close your eyes. I'm going to write a letter in your hand, and I want you to tell me which letter, okay? Mm-hmm. Good. Making sure your eyes closed.
N?
Facing me, yes, but...
Z.
Yes, facing you. And then with this one?
A.
Perfect. I have two objects with your eyes closed. I want you to tell me what the object is when I place it in your hand.
Candy bar.
Yep. And then with this hand?
A quarter or nickel?
Yeah, it's a coin. But yeah, it got specific. It is a nickel. Okay, with your hands out, I'm going to have you tell me if I'm pushing down or pulling up on your finger.
Pushing up. Pushing up. Pushing down. Pushing down. Pushing down. Pulling it.
Great. Lastly, we're going to do psych. So can you tell me where you are right now?
In a house.
Yes. And what's your name?
Rebecca.
And what month is it?
November.
Okay, perfect. I'm going to tell you 4 words, and at the end of this, I want you to see if you can recite those 4 words again.
Okay.
Apple, book, sock, and pocketbook.
Okay.
Okay. What did you do for your birthday last year?
Went to the bar.
Okay. Can you count backwards from 100 by 20s for me?
Yes, so right now?
Yeah.
Yeah. 100, 80, 60, 40, 20, 0.
Good. Starting from 100, can you count backwards by 7s as best you can for, we'll see how long.
Okay, 100, 93, 86, 79, 72, 65, 58, 51.
That's good.
Okay.
You're good.
It's hard.
Next, I want you with this piece of paper to do what it says. Good. And can you recite for me those 4 words that we discussed?
Apple, book, sock, pocketbook.
Great. Good work. Thank you for your time. And, yeah, we're done.